everyone to the second webinar of our 2023-2024 webinar series. And as you know by our announcements out on Facebook and in the newsletter, that the first four that we're doing are primary financial assistance programs for people with Fabry disease. So I'm going to introduce Casey McKenna, Casey is the Senior Program Manager for the National Fabry Disease Foundation. And Casey is going to introduce our speaker, Stephanie, from the Assistance Fund. So with that, welcome.
Great. Well, thank you, Jerry, for the introduction. And I'm so thankful that Stephanie Marshall has been able to join us today. Stephanie is the Director of Patient Advocacy for the Assistance Fund. She has more than 25 years of policy advocacy and communications experience in the public, private, and nonprofit sectors. Stephanie has devoted her entire career to improving health and quality of life for individuals, families, and communities. At the Assistance Fund, her job is to collaborate with patient advocacy organizations to ensure that the programs and services meet the needs of patients and caregivers. Just a little housekeeping while Stephanie's talking, feel free to pop questions in the chat for later, and I'll ask them for the room later. And let's see, can everyone see my screen with the Assistance Fund slide?
And thank you, Stephanie, so much for being here with us tonight.
So we have got your cover slide up, Stephanie.
All right, great. All right, well, good evening, everyone. And thank you, Jerry and Casey, for inviting me to be with you tonight. And I have to apologize for some very late technical issues. My internet decided to become unstable at 6:45 tonight. So with Casey's help, we've kind of found our workaround. So thank you, Casey, for showing my slide deck. And I'm dialed in. So I'm sorry I can't see people on the screen. So I apologize for that, but I still hope we can have a good conversation tonight. So next slide, Casey.
And if you're new to if you can't see Stephanie's slides, click the upper right-hand icon on your Zoom gallery box in the corner.
All right, thanks, Jerry. So tonight I want to cover a couple of different topics. So a little bit of information about the Assistance Fund and our Fabry Disease Financial Assistance Program, including eligibility criteria and how to apply to the program, some information about the enrollment process, and importantly for those already enrolled in TAF's Fabry program, a little information about the re-enrollment process. And then I'll end by mentioning a few sources of information that might be helpful to the community. And then lastly, how to contact TAF and follow us on social media. So next slide, Casey. So there are generally two types of patient assistance for financial support. And I know that managing a serious medical condition is challenging, and I don't need to tell you all that. It's not just the worries about having a serious condition or caring for a loved one with a serious condition. It's having to navigate a fragmented healthcare system, dealing with health insurance problems, following up with providers, or even traveling a great distance for care and treatment. And then there's the financial worry. Medical bills, prescription co-payments, and health insurance costs add up and can be a burden to many individuals and families. The Assistance Fund and other groups like us, and I know you heard from Pam last week, can help with out-of-pocket medical expenses. And these are the expenses that insurance doesn't pay for. They are the co-payments you make when you pick up a prescription or receive treatment. They can also include a monthly health insurance premium or the co-payment at the doctor's office. They may even include the cost of traveling to get treatment. There are generally two types of programs that can help with out-of-pocket medical assistance. The first are independent charitable patient assistance programs. And these are groups like the Assistance Fund and PAN that are nonprofit organizations. The second type are called manufactured patient assistance programs, and they're run by the pharmaceutical companies. Both programs offer financial support for medications as well as other medical costs. But there's some important differences between the two types of programs. So I just want to do a little level setting. So my organization, TAF, is considered an independent charitable patient assistance organization. And as I mentioned, we're nonprofit charitable organizations, just like the National Fabry Disease Foundation. And we rely on donations from individuals, foundations, and corporations to do the work we do. Manufacturer programs are run by the pharmaceutical companies. Independent groups, the nonprofits, provide financial assistance for all FDA-approved treatments, including generics. The programs run by the manufacturers provide financial assistance only for their branded products. So that's one of the most important distinctions between the two types. The other important distinction is that the charitable patient assistance organizations assist patients with both private insurance as well as government insurance, such as Medicare and Medicaid. The manufacturers are not allowed to aid patients with Medicare and Medicaid. So those are the two big differences between the two different types of organizations. So tonight, I'll just talk about the Assistance Fund, and I think you had Pam last week, and I think you have Accessia next week. Is that right, Casey? Or later this month?
Later this month, I believe.
I think, yeah. So we're all in that independent charitable patient assistance category. So let me tell you a little bit about TAF and then the specifics about our Fabry program. So next slide, Casey. So the Assistance Fund, we're the nonprofit, and we provide financial assistance for co-payments, co-insurance, deductibles, and other health-related expenses. We manage nearly 90 different disease programs, including one for Fabry. And our programs cover all prescribed FDA-approved treatments for the condition named in the program. And this is part of a regulation that we follow by the U.S. Department of Health and Human Services. And once a patient applies and is approved and enrolled in any of our programs, there is no cap on the amount of financial assistance an individual can receive in a calendar year. And that's, we're very proud that we're able to do that. And lastly, patients must apply for re-enrollment every November and December for assistance in the following calendar year. And I'll talk a little bit more about that later in my presentation. So next slide, Casey.
Yep.
So we were founded in 2009, and since then we've helped nearly 180,000 patients in all 50 states, Washington, D.C., and Puerto Rico. We only provide financial assistance to U.S. citizens or permanent residents. I'm often asked if we can, support families and patients in Canada or Europe, but unfortunately we cannot. Last year, we provided financial assistance to more than 40,000 patients, and the majority of the individuals we serve are Medicare beneficiaries. Every year, we survey our patients to ask about the 3 biggest obstacles or challenges to improving their health care. And the top 3 are affording their health care, making lifestyle adjustments, and finding an effective treatment. And we understand those challenges here at the Assistance Fund and work hard to put the patients at the center of everything we do to help meet those challenges. The next slide, Casey. So 5 years ago, we launched a Fabry Disease Financial Assistance Program to help with the out-of-pocket medical expenses. We specifically provide financial assistance in 5 different areas. 1, we provide support for prescription drug co-payments, deductibles, and co-insurance. We also provide financial assistance for the cost of health insurance premiums, so the monthly premium, therapy administration costs, genetic testing, and then treatment-related ground travel costs. So that could include, a personal vehicle, some mileage reimbursement, car rental, cab or ride share for treatment, a hotel stay, meals related to that travel, and tolls and parking. And to obtain assistance from the Assistance Fund, you have to meet certain eligibility requirements and submit an application to enroll in the program. The next slide, Casey. So there are 3 steps to obtaining financial assistance. So 3 steps to the process. The first step is determining the status of the program. All of our programs are either open and accepting new enrollments, closed to new patients but accepting applications for the wait list, or closed completely because we are processing applications for the wait list. And I'll talk a little bit more about that in a moment, but our Fabry disease program is currently open and accepting new applications. So I do want to make that point very clear. Step 2 in the process is determining eligibility, and step 3, the actual application and enrollment process. And I'll go over each of these 3 steps. The next slide, Casey. So the first step is determining the program status. And as I mentioned, a program is either open, waitlisted, or closed. So on our website, it clearly indicates the status of the program. So Fabry is open, but other programs are waitlisted and some are even closed. But that's always clearly noted on the website. So since we are open, we're accepting new applications for our Fabry program. And I do want to mention that sometimes the program might be waitlisted, and that's because we're simply processing applications and just kind of want to go into what I call a holding pattern to make sure that we have enough funding to serve all of the patients who are part of the program. So that's why we sometimes waitlist. And then lastly, a program might be closed. And this means that we are unable to serve additional patients due to funding limitations. And that does happen from time to time, but typically not with the Fabry program. So again, the status of each program is always clearly indicated on our website. The next slide, Casey. The eligibility. Naturally, eligibility is a key question we get, and there are 5 elements to eligibility. The first one is meeting certain income requirements, which are based on household income, annual income, and size. We also require individuals to have health insurance of any kind. So it can be commercial insurance, Medicaid, Medicare, TRICARE, VA, any type of insurance. Be a U.S. or permanent resident, as I mentioned. Have a diagnosis of the condition named in the program, and have a prescription for an FDA-approved treatment for Fabry disease. And so we can only cover for reimbursement those FDA-approved treatments. So sometimes the treatment is used off-label or is still in clinical trial. We're not able to provide financial assistance in those scenarios. Since eligibility is often a question we get, we have a screening tool on our website, which you can answer, half a dozen questions, and you find out right away if you're eligible for the program. So we try to make that easy. And I'll talk about the application process next. So next slide, Casey. So the actual application process or enrollment process. So to enroll in a program or be placed on a wait list in the event that a program has that waitlist status, it is necessary to submit an application. And applications can be submitted by an individual patient, a caregiver, or by a provider such as a pharmacist on the patient's behalf. There are several ways to apply, either online, over the phone, or with a paper application. The preferred method is online because we can let an individual know immediately if their application has been accepted. So to apply online, someone can go through the eligibility tool on our website that I just mentioned, or go directly to the Fabry Disease Program page on our website and just click the button that says apply and fill out the application. The application is really pretty straightforward. It includes questions about annual income, type of insurance coverage, residency status, and the type of treatment required to manage the condition. We also ask for some demographic and contact information, but we do not ask for a Social Security number or Medicare number, nor do we ask for tax forms or other documents. So we really try to keep it simple, easy, straightforward. I will say, however, that occasionally our compliance program does require us to periodically audit and review a select number of applications and program records. And if that's the case, we may ask for additional documentation, but these types of documents are never required at the time of application. An application can also be submitted over the phone, and we have a contact center that's staffed Monday through Friday, 8 a.m. to 7 p.m. Eastern Time. And a paper application can also be submitted by, electronic upload or fax, but it takes a little bit longer to review and approve a paper application, which is why we do encourage the online application. After a patient enrolls and is approved for any of our programs, within 48 hours, they receive an automated introductory welcome call outlining eligible expenses. And within 7 to 10 business days, they receive in the mail their member card and more information about the program. So lastly, I mentioned, that pharmacists, providers, case managers, and others can apply on behalf of a patient. And that is the case. If they meet the eligibility criteria, the patient can receive immediate conditional approval, but for 30 days. But then within that 30-day period, the patient has to submit a completed application in order to continue the assistance beyond the initial 30 days. So I know that's a lot of information, and at the end, we can, during Q&A, go back to this topic and any of the other topics as well. So next slide, Casey. The reimbursement. So the way our program works is that we reimburse the individual for the expenses they incur. So we reimburse for those out-of-pocket expenses through a PNC bank debit card. I will admit, sometimes the process can be a little bit clunky because you have to submit proof of payment and proof of treatment. So when I mention the different areas that we cover in our Fabry disease program, it might be a monthly health insurance premium statement, and then proof that that premium was paid. Or it might be a statement after getting a treatment, and then a statement indicating that that cost was covered. So it is a little clunky. So it's receipts, billing invoices, bank statements, health insurance billing claim forms, the EOB, an after visit summary. So it's that documentation. And then once we receive and approve it, the funds are transferred to the PNC Bank debit card. All reimbursement claims have to be submitted by March 31st of the following calendar year. But we often encourage people, it's best to submit reimbursement and claims as the expenses incurred. And again, all the documents can be submitted online, fax, or by mail. So when I talk to groups, sometimes the reimbursement issue often generates the most questions and sometimes the challenges. So maybe we will need to go back to that. So Casey, next slide. So program re-enrollment. So all of our programs I mentioned, we have more than, nearly 90 different disease programs. Each November and December, individuals who are enrolled in the program have to apply for re-enrollment. It's a re-enrollment application. And 2 different re-enrollment time periods. The Fabry program, we're in it right now, runs from November 1st to November 17th. So if you are currently in our Fabry program, I hope you have received information. In the month of October, you should have received different mailings by regular mail, email, and or text about the enrollment process. And that correspondence should have included a unique re-enrollment link and pin for you. It opened on November 1st last week and will run through 7 p.m. on the 17th, so next Friday. If you did not, for any reason, receive these mailings and you're in the Fabry program, you should contact the Assistance Fund. And I'll in my final slide have that phone number. just to verify or update contact information. We want to make sure that, nothing falls through the cracks. Typically by the end of December, we're able to let you know whether or not your application has been accepted for the following calendar year. So maybe there may be questions about re-enrollment that we can get to at the end. So next slide, Casey. So I mentioned earlier the manufacturer patient assistance programs. There's a search engine called the Medicine Assistance Tool, or MAT, MAT.org. And you can go online and input a few pieces of information, and the search engine will bring up all the different manufacturer programs that may offer copay assistance for the various treatments that you enter. It's a helpful tool to identify additional financial resources for various treatments. So I always like to share that information. So next slide, Casey. So on our website, we have what we call our patient resource hub, because we recognize that many patients and caregivers and family members are seeking information and resources for a range of needs beyond financial assistance. So we created the hub a couple of years ago to be really a one-stop shop of resources from a variety of nonprofit and governmental organizations, including the National Fabry Disease Foundation and others that provide helpful resources. So they include, the different patient advocacy organizations, the rare disease organizations that support the community, different types of financial support and community-based resources. One of the resources we list is a group called findhelp.org, and that's a zip code-based search engine, and that's a really good resource for all kinds of different sources of financial support. Then we list other health insurance and government resources, so Medicare.gov, CMS, caregiver and emotional support resources, aging resources, and then a listing of the other independent charitable patient assistance organizations. The next slide, Casey. So here's some information on how to contact TAF. So our main number there, that's the 855-845-3663 number. If you are currently enrolled in the Fabry disease program and didn't receive any information about re-enrollment, it is very important to call in our main number tomorrow to make sure you get the information you need for re-enrollment. We do have a specific phone number for our Fabry disease program. So if you do have any questions at any time, that's a good number to call. And we're based in Orlando, Florida. That's where our headquarters is located. And I am tied to our Washington, D.C. office here. I know many of you are active on social media, and Jerry mentioned at the top of the call that, this webinar and the others are promoted on social media. So the Assistance Fund is active on social media. So you can find us on Facebook, Twitter, Instagram, LinkedIn, really your favorite channel for those who do use social media. And then next slide, Casey. So as I wrap up, and I know I've given a lot of information, and I hope we have, some good dialogue and discussion. I want to share with you the Assistance Fund's vision for the future, which is to see the day when no person goes without treatment because of an inability to pay. So our mission is to provide underinsured people living with life-threatening chronic and rare diseases access to critical treatment through financial assistance, education, advocacy. So until that day arrives, the Assistance Fund is here to support communities. And it's my privilege to help support that mission, and to be with you today. And I often say to people, I've got a great job. I get to help people. I get to work with great organizations to raise awareness and facilitate enrollment. So it's a privilege for me to serve TAF's mission. Next slide, Casey. So I'm sorry I'm not on screen with you, but that's, my picture, and I really appreciate you, listening to my presentation tonight. And I want to thank the Foundation for supporting and serving the Fabry community, and I look forward to working with the Foundation in the future. And I'd be happy to take questions. And also, I'd love for your feedback, sort of different needs that you had maybe at the time of diagnosis, current needs, and future needs, because we're always trying to think about additional ways we can support different patient communities. So I'll maybe stop there, and thank you, Casey. And I know, Casey, you're going to help with the Q&A.
First question. Does therapy administration assistance include nursing services and home infusion?
Yes, it does. Yes, that's an excellent question. Yes, so it does support home infusions and the nursing costs. And I know many commercial insurance will cover a nursing visit, but Medicare does not. But we will cover the cost of that nursing service to help with the home infusion. That's an excellent question.
And does that include infusion supplies as well?
Yes.
Awesome. That's great.
Yeah.
And for a person to be approved for eligibility, is treatment defined solely as enzyme replacement therapy? Or can they be getting treatment by multiple providers like cardio, gastro, neuro, et cetera?
Yes, yes to both those questions. So on our website, on the Fabry disease page, there's a listing of the covered treatments. So enzyme replacement therapy, the different types, and then also the different treatments that are prescribed to help manage the symptoms related to Fabry disease. So there's a list that's probably about 24 different types of treatments.
Yeah, and I have pulled it up on the website and shared my screen, so you can see there's a pretty long list here. And it does include some of the newer approved treatments as well.
Yes, so any FDA approved treatment for Fabry would be on that list.
And then are you ever able to assist with living expenses and emergency needs like rent, electricity, car repairs, gas?
Yes, unfortunately not. I wish that was the case, but because of funding limitations, we just focus our support on the medical side. But I know, the website I mentioned, findhelp.org, there is a zip code base, and you can search by zip code and by the type of assistance. That's right, it could be utilities, rent, educational support. Sometimes the local United Way will also provide assistance in those areas.
There's someone on our call who is looking for some advice about ending employment, where they're deciding what to do about possible using COBRA coverage. When would someone with COBRA be able to utilize the assistant funds program?
Yes, yes. Because COBRA is a type of insurance, so any type of insurance. So yes, if they have COBRA, if they're using COBRA after leaving a job, yes.
So that person would apply to TAF saying that they do have health insurance.
Yes, correct.
Okay. If someone is having a procedure and they have a significant copay, is that something that TAF would be able to help with for something like a spinal nerve ablation?
If the procedure is pertinent to managing their Fabry, possibly. And something I've done with other communities, if there is a question like that, I can help facilitate getting an answer before the procedure moves forward. But yeah, so for example, I'm working with a family, the patient needs a port implanted to help with infusions. And we are able to cover the cost of that implantation because it's related to receiving treatment.
Okay.
So possibly we would be able to cover that copay.
Okay. And then a person has filled out the application form or the re-enrollment form, and they weren't asked for income information. Is that something that'll come later?
No. So the re-enrollment application is sort of an abbreviated
So if it's the first year
Um,
they were asked that, and then the second year it just kind of auto populates.
yes, yes,
Okay.
yes.
And if there's no significant change in income, do people need to do anything?
No. Mm-mm.
Awesome. All right, so many questions. We've got another one for you. Is
Okay.
mileage reimbursement only for infusions, or is it also for travel to doctor's appointments for related to Fabry?
Both. Both. So anything related to infusion or to physician visit. Yes. And the mileage, it is for if the individual is more than 50 miles or more from the site of care.
Okay.
So when there is a little bit, a little bit of a drive or a distance. And I know for many people, sometimes, that travel can be significant, to a different state or part of the country even.
Okay.
I'd like to address Bridget's question. So we have a question about treatment and how it's defined. So, and I may be wrong about this, but my opinion was that for any of the assistance funds that you people can get assistance if the treatment for their disease is covered under your eligible treatments. But that did not mean that you had to be on the Fabry specific treatment, in our case being Fabrazyme or Galafold or now Elfabrio. You had to be in the group that had an eligible treatment. But even if you weren't on the specific treatment, you could still get care for all of the things that we have to do, like MRIs and ultrasounds and labs and all those sort of things. Is that true, or do you have to be on the specific treatment to get those other kinds of assistance?
Yes, that's a good question, Jerry. So our Fabry disease program provides assistance in the 5 areas. So prescription drug copayment. So it would be, one of the FDA approved treatments for Fabry or for the management of Fabry symptoms. The health insurance premiums, the therapy administration costs, so that would be the infusion, genetic testing. So those are the 4 medical areas. And then the 5th being the treatment-related ground travel costs. So, and actually, Casey, a question or two ago asked about the procedure. I don't think the medical procedure would fit in those 4 categories. As I think about it again.
Yeah, I think we need to answer that question more specifically for not only the TAF, but for our other financial assistance programs also. Because
Yes.
we can incur some big bills in all of the things that we have to do that are related to Fabry disease, but not a person may go off treatment for a while. Still a covered treatment, but they may still need all of those other things. Their annual cardiology, nephrology, pulmonology, gastroenterology, all of those other things that we do. So, that's something we'd like to get answered with, if you can look into that further, Stephanie, and we'll ask the other organizations also.
Yes, definitely. I can do that, Jerry.
Thank you.
You're welcome.
And follow-up questions about the mileage reimbursement. Is there an adjudication process if someone gets denied because it's not related to this or that? One member said that they were denied mileage reimbursement because they went to a doctor's appointment and it wasn't an infusion. Do you think that was a mistake or something that could be looked at again?
Yeah, no, I think that ties back, Casey, to the issue we were just talking about. So the medical procedures and doctor's visits that are not related to an infusion.
Okay. And what about annual visits to the person who prescribes that infusion?
Yeah, that's where I think that category is not included in the Fabry program.
Okay.
I guess
so these are...
going back to that discussion, like as I think through it, I think the fact that you're able to support insurance premium assistance, in a lot of cases, that will cover all those other ancillary things. Because a lot of those ancillary things are covered with the other insurance, not related to specific Fabry treatments like Fabrazyme or Galafold or Fabrio. So that may answer part of the question, but there's still probably things that I don't know if in Lillian's case, that same idea, if any of that is, like as she said, there's a copay related. So even if she has insurance premium assistance, they may not cover those copays. But I know that there are a couple of other copay programs, but I'm not sure exactly what they address also. So we'll have to look into some more of that also.
Yeah.
Okay. Back to you, Casey. Any more?
I don't have any other questions that are in the chat. Yes, anyone with private insurance or public insurance can apply for this program. I know that one. And then, do you get other frequently asked questions that we are missing, Stephanie?
Oh, that's a good question for me. You know, I do get asked about, you know, the adult child coming off the health insurance. That can definitely be a challenge for a young person who's maybe, you know, early in a career journey. And so we do that. I do encourage people, you know, sometimes people don't take advantage of the treatment-related travel reimbursements. So I do encourage people, you know, hang on to the receipts and to utilize that part of the program. But I think we really covered the main topics I do hear about. I do sometimes get a...
Go ahead.
Oh, go ahead, Jerry. Go ahead. No, it's all right. Go ahead.
Christina's question about insurance. So I'm guessing here is that she says she has Aetna. Can she still apply? So I think in my mind, people can have an insurance company pay the premiums, but can also get premium assistance for a secondary insurance. Is that true?
Yes, that is true.
So that answers Christina's question, I think, is that you can get secondary insurance premium assistance. Okay.
Yes. Yeah, so we essentially reimburse for the out-of-pocket expenses that insurance doesn't cover. So, right, that's the copays, and that is actually even also the monthly health insurance premium you pay to have the insurance. We can cover that.
Right. Great. I think we may be out of questions. So, do you have anything else, Casey?
No, I do not. Just a big thank you to Stephanie for presenting today and making the best of some internet issues.
Great. Thank you so much, Stephanie. And next...
Oh, you're very welcome.
Sorry, go ahead.
Welcome. Oh, you're very welcome. And, you know, thank you. I'm delighted to, you know, join you tonight. And thank you for inviting me and including me. Thank you. And I will get back to you, Casey, on some of these kind of outstanding questions and issues.
Awesome. Great. Thank you.
So we have a couple of closing remarks, but before we do that, Casey, let's set up the prize drawing.
Okay. And did you want to have have everyone enter something, or are we just using it from the whole list of who's here?
No, we can just use TAF as the word this time.
Okay, so we have two prize drawings that you may be eligible for today as an individual with Fabry disease as an adult, or a family member of a person with Fabry disease. Our industry friends and sponsors are unable to participate in these raffles. But if you would like to participate, the first one, you're just going to type into the chat box TAF, T-A-F. And we will take a look at the number of people who get back to us. And
So put 2 things in the chat box. We'll get them both started. And then we'll make our, well, that might make it too difficult. Let's finish TAF and then we'll go on to the next question. And then we'll have some announcements. So I guess while everyone's putting in TAF, to make sure we give Brittany a few minutes to count the number of people, we'll ask or just remind you that if everyone is not signed up to our e-newsletter, please do that. And you can contact Casey or I if you don't know how, but we publish the how often in many places, so you should have that already. And it just keeps you informed about what we're doing, the various programs that we're managing, and what's happening in the moment as much as we can. And also, if you have not taken what we call our December 2022 patient reported outcome survey, please do that. And we'll rename it differently the next time we put out a big survey, because it's confusing to people that we're still doing a December 2022 survey. And that survey will remain open until the end of this year, until the end of December in 2023. So it's a year-long survey. But if you have not done that, we offer a great array of educational resources and a $50 gift card for taking that survey if you are an adult with Fabry disease or a 17-year-old that will turn 18 by the end of the year. So please do that if you haven't already. So do we have a number for the TAF responses, Brittany?
she typed in 16.
Okay. So what I'm doing now is I'm going into a random number generator on my phone, and I'm typing that I would like a number, an integer between 1 and 16, and then I select generate, and it gives me a number, and the number this time is 8. So Brittany, who's the 8th person on your roster? Lillian, congratulations. We will send you a $50 gift card. And the next drawing, Casey.
I'm thinking, so this next drawing is for people who have completed that PROS survey or intend to complete the PROS survey soon. So if you could type PROS, P-R-O-S, into the chat box if you'd like to be eligible for that second and last drawing.
And if you have not yet completed it, but if you're willing to in the next couple of days, you can go ahead and enter PROS in the box. We will get your survey in the next couple of days, and that makes you eligible to participate in this drawing. So again, as you're typing in PROS, we would just like to ask you, we have a series of webinars already planned. We have the 4 financial management or financial assistance surveys planned. Next, we have 3 or 4 mental health webinars planned. 3 or 4 mental health webinars planned. A couple of other kinds of webinars than the industry health or industry patient care programs planned. And so if you have any ideas about what you think we should do a webinar on, we're welcome. We'll thankful for those recommendations. We think we have one planned for Social Security disability. We have one planned for kids 504 plans, I believe they're called. And so we've got a series lined up, but if you have recommendations for additional webinars we can put on this year and next year, then we're grateful for your recommendations. And any other recommendations that you have for the National Fabry Disease Foundation, if there are things you believe we can support the community with that we're not doing, please send those in. We do our best to meet all of the community needs we can. So while I've been talking, Brittany has been counting the PROS entries. And so Brittany, do we have a number for the next drawing yet?
We have 11.
11. So again, I'm putting 11 into my random number generator, and the winner for the second prize is number 3. So who is number 3 on the roster? Kathy, congratulations. And we'll just
We'll email both of the winners.
We'll verify that you have a survey in the system here, or expect one from you in the next couple of days. And before we close out tonight, Casey, do you have any other comments?
I do not, apart from saying that we have 2 more webinars in our financial assistance program series scheduled for 2 weeks from today and then in December. So if this program doesn't quite meet your needs, we hope there will be another one that might.
And Casey and I talked recently that when all of this is finished with the 4 primary financial assistance programs that we have information about, we'll provide a matrix to the community to sort of compare and contrast the different programs that each financial assistance program provides. So expect that from us. And with that, I would like to say we really appreciate your participation, and we really enjoy, we're proud of the fact that we are able to support people with Fabry disease like me and you. And so for those of you that don't know, I'm an old guy, you can see me, but I'm a 68-year-old male with classic Fabry disease who had a heart transplant 3 years ago. And I am doing well. I hope that you can see that. And life is good. So there's hope for all of us in living to good old ages and being relatively healthy as we continue on our journey. So thank you all so much, and we'll see you next time.